Measles update in the United Kingdom. I am Dr. Nadeem Sajjad Raja. Measles spread very easily among those who are unvaccinated, especially in nurseries and schools. People in certain groups, including babies, pregnant women, and people with weakened immune system or at increased risk of complications from measles infection. The data published by United Kingdom Health Security Agency in this epidemiological overview. This overview covers the period between 1st October 2023 and 13 February 2024 and is currently provisional, and suggested that clusters of measles cases have been found in regions outside of the West Midlands area where the initial outbreak occurred. There have been 521 cases since 1st October 2023. In the last 4 weeks alone, since 15th January this year, there have been 166 confirmed cases. The majority, 343 out of 521, 55%, were in the West Midlands, mostly in the Birmingham area. The UK Health Security Agency said case numbers in that region appear to be stabilizing. The remaining cases were reported in the following regions: 12% in London region, 10% in the Northwest area, 10% in Yorkshire, and the Humber 9% in the East Midlands. The majority, 66% of cases, are in children under the age of 10 years old, and 25% are in young people and adults over the age of 15 years. This is due to worrying low MMR vaccine uptake in some areas across the country. Parents are coming forward to take up the offer of measles, mumps, rubella vaccine for their children. There are still hundreds of thousands of children who remain unvaccinated and therefore remain at risk of serious complications of this disease or lifelong disability. Measles is completely preventable with vaccination. So I strongly urge parents to take up the offer of measles, mumps, rubella vaccine now to make sure their child is protected. Thank you very much for watching this video.